the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:23. Well, April is National Autism Awareness Month, and autism refers to a range of conditions characterized by challenges with social skills, repetitive behaviors, speech and nonverbal communication, as well as by unique strengths and differences. Joining us this morning to help raise awareness this month is Baptist Health's Dr. Devin Ballard. Thanks so much for being here this morning. You know, a lot of people have concerns about this when they have a child, and you're looking for those developmental milestones. When would a parent start to notice there may be some signs of autism in their child?
Usually there's signs and symptoms as a early childhood, usually seen before the age of 2, but sometimes seen at 6 months. It can be 8 months, a year. It could be, autism used to be, there used to be Asperger syndrome and different kind of variants of autism. Now it's all lumped into the autism spectrum disorder, which can be mild or could be severe, very functioning and non-functioning. So usually there will be some type of developmental issues, not necessarily motor, like you'll see in like a cerebral palsy, but more developmental of words, socially awkward, not responding to the parent normally like you would at 1, 1.5, or the language skills will be doing okay at 1 and 1.5, and then they'll regress. Instead of kids absorb words like sponges when they're young, and they're learning new words every day, and then they start regressing or being socially awkward or more aggressive in mood.
So these can show up as early as 6 months. Is there anything that we know causes autism? That's also been a big debate.
We still hear it all the time about autism and vaccines. This has been proven unequivocally that there's no association with vaccines and autism. There's no specific cause of autism that anybody has pinned out, but the vaccine-associated autism has been proven to be wrong by significant studies and research. It just happens. There are some things that make it more likely to happen. On a study in autism and autism spectrum disorder, it's shown to be males are actually 4 times more likely than females to have autism. If there's a family history of autism in a family, it's more likely that will be autism in another child. Doesn't mean it's going to happen, but the odds are more likely.
So some factors can increase that. I know you've probably seen in your practice parents that have come in with concerns about developments in their child, and you've suspected autism. Correct.
I mean, I do more adolescents, so I've seen the kids after they've already been diagnosed, and they're some very high functioning that are still going to junior high and high school, still going to go to college. Some that aren't as functioning. A lot of the moderate to severe type autism I've seen even last week in somebody who's 21 years old. They had, when they're sitting on my table, they're not looking me in the eye, poor eye contact, some verbal stuttering and awkwardness, don't like to be touched. That was more the moderate severe that's probably going to have help with functioning in society. But then I've had somebody a month ago that is getting ready to go to college at TCU. And so it depends on the programs that they've been put in when they're younger to try to compensate, to be more socially aware and to handle their situations the best they can.
And the early intervention is so important. If you suspect autism in your child, go see your physician and you can start those treatments early. Dr. Ballard, thanks as always. If you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.